Let's get started talking about knee pain. Who's ever had knee pain before? I have. Dang it. And when people have knee pain, sometimes they never get it healed because they never really take care of it properly. You go to your doctor, get an MRI done, sometimes even surgery, but never really heals properly. So my homework today with you guys, how I treat with patients with knee pain is going to be what I'm going to give you, to give you the basics to where, okay, is it a, say, grade 1 sprain, grade 1 strain, maybe some simple things here and there, but if it doesn't, I always tell patients, if I'm seeing you for back pain, neck pain, neuropathy, whatever it is as a chiropractor, you're not getting better with me within 2 weeks, there's something I'm missing. I do x-rays in my office. I go, let's go get an MRI. Maybe blood work, maybe something else we're missing, maybe your diet, but maybe whatever it might be, versus mechanical, what you call mechanical, simple back pain, neck pain. So I want to make sure we're getting the right care wherever you are. Grab a seat here if you want, sir, right over here. Make sure you get a handout too. Make sure one of these handouts, right over there. At that point, we want to make sure that we're doing the right things for myself, but also other people too. I want to make sure, some people know, I want to make sure you're your best doctor, that you're taking care of you. So at that point, when you go see your medical doctor or chiropractor or specialist, you have the right questions to ask because now you have more information. If you go to tell your doctor, I have some knee pain here and there, it comes and goes, what's your medical doctor going to do? What's the first thing they're going to do? How are they going to help you? Give you medication, right? Here's your script. Go see the pharmacy. And if it's not getting better within 4 weeks, give me a call. We'll see you 4 weeks after that. So you're 8 weeks out for your next visit because you already tried medication. You've got to tell the doctor you're doing that. So you want to make sure you're doing the right things for yourself, ask the right questions, take care of your body. So what happens if you have a knee problem too long, I have a lot of patients that do labor work. Iron workers, linemen, UPS employees, they're running all day long. Sometimes they go, it wasn't bad enough to get checked out. But then they see me, they need surgery. So getting taken care of initially when it's first become a problem, either on your own with these exercises, stretching for 1, 2, the Rice technique also. Not getting better, then it's okay, what else can I do? So take care of any problem you have right away if you can on your own. If not, seek special help. If not, go see that chiropractor in Upland that you may know, which is me. Just curious. So first thing is, I always look at people's posture when they're standing or sitting when they have knee pain. Okay, so what I have people do, I'll go right back here in a second, right back here in the wall, is I'll show you if someone's standing improperly, I'll give you proper first here. Let me back it up a little bit, I think. Sorry, I'm going to get in your way here a little bit. Here. If someone's standing improperly, or properly first, right, it's standard. If I'm here standing, okay, I want to make sure someone, when they stand up, say against the wall or standing in general, their body is more on their heels, their body, from the angle over there, more like this here, and more like this here. The problem is when you have people have knee pain, sometimes what they'll do with their feet, instead of being straight, the one foot might be turned out a little bit. What happens when you turn your foot out and you try to walk that way? Now instead of loading your quad muscles, your femurs and your tibia and your hips evenly, now you've caused that shift. So when you do that, that right arch, which is the arch right here, then drops. Now you cause your hips to become unlevel. If you're unlevel there, you're causing more pressure on the inside knee, causing knee pain. It can be one coming out, can be both coming out too. And this is common to happen because your quad muscle here is one big muscle. And if you break it up to the quad muscle, you can break it into the magnus, the middle part, medius inside, and lateralis outside. You can also have a secondary muscle on the outside called the TFL band, which goes from your hip that goes past your knee. If you have that muscle over time as we sit a lot, even stand and walk, that muscle can pull our leg out to naturally feel like this is your posture standing instead of this being your posture. When we're driving, even when we're driving too, does your foot ever just go out when your pedal foot, does it ever just start going out slowly? Mine does. So I want to make sure my foot stays, when I'm driving, my foot stays straight. It doesn't come out to the side. Any questions about that? Okay, so if you're sitting too, same thing where you are now. If you relax your feet, just relax your feet and go, if I relax my feet and not look at my feet, does my feet naturally come out a little bit? Does it stay straight? Where is my feet? To help someone correct that just from that position too, what I'll do if they have that is I'll tell them, in your head right now, in your head, your feet are basically, in your mind, your feet are straight, even though you're like this, okay? So you're gonna have to feel that your feet are going inwards because your feet are gonna be more in a normal standard position. Any questions about that? So Paige goes, yeah, my feet feel great, doc. I'm like, okay, but your foot's out here, so that's your straight right now. That's your mind's telling you that's your straight. So we want you to feel like your feet are going in, even though they're more optimal, normally straight, versus being out. It's more of a perception versus what you think your normal is versus an ideal normal. Take away the knee pain. All right. Any questions yet? Anything? All right. Good. It's uncommon to have this. This is more good question. If my feet are in case say one foot's in, that might be more of a tight muscle inside here, or you're protecting that knee by putting more pressure on your left. So you may walk like this a little bit because that knee hurts or that hip hurts, or you've had post-hip surgery or post-foot surgery. Now you've learned to compensate by putting more weight here. That would be the only reason I've seen in my practice where you'd have your foot turned in versus out. So again, if you're same thing, but if my feet are turned in, say my left foot's turned in, my mind's still telling me my left foot's straight. I want that person to feel, I'm going to call them Johnny B or something. I'm going to have that person feel like their foot is coming out so they bring their foot more straight. By doing that now, if my foot's in, now we even out the hip weight on both sides, take the pressure off it'll be the outside knee and outside foot and outside hip. All right? And just to reset, so I always go, this is standard normal, standing straight. Where's the feet? Where's the hips? Where's the shoulders? Where's the head? And my level where I'm straight here, my shoulders level, hips at the hip joints are level here, and my feet are straight. That's my first start. So if someone's walking a lot like this, their body should be evenly balanced. Walking like this with your foot out, now your body's going to add again. It's going to drop the right hip. Going to drop the right hip, put more pressure on the inside knee when you walk, and cause even plantar fasciitis in your foot too. So everything is connected, right? So hips, knee, and foot is all connected. So when I have someone has problems with knees, I go, how's your hip? How's your foot? How's your back? If I'm like this, my foot's being dropped. Now my back, even my back here, will have to drop on that side, cause me to turn a little bit, so I'm going to bring my body back here, causing more torque, more pressure. All right? So always look at that first as my first assessment, same thing for you guys. Any questions yet? Anything yet? Cool. All right. Let's go back here.
But I agree with what you say right now.
What's that?
I agree, when you don't stay straight.
Yeah, when you're off, it's hard to get your body. So the problem is, why is that? Why do most doctors not see feet problems affecting the knee? Why do most doctors don't look at the feet or the hips? Why? Why? Why?
They don't look at you.
What most doctors tell me, or physical therapists or doctors that are more, say, I want to say better doctors, but more functional medicine doctors, is they say doctors now are compartmentalized. They're sectional. Big word for me. Big word. Compartmentalized. So at that point, they're just knee doctors. They're just foot doctors. They're just hip doctors. They're not a person doctor anymore. The way that's been told to me. So if they're just knee doctors, why would they look at the foot? If you have a foot problem, go see your foot doctor. So can we look at the whole person, what we do as chiropractors? I did a talk with for our podcast with a naturopath. He's also a functional medicine doctor too, in Tulsa, Oklahoma on Monday. And they do well because they look at the whole person, mind, body, whole body for 1, 2, their lifestyle. How many doctors use that now? Very, very little. Most medical doctors, as we know, soapbox, is they spend 5 minutes with you, maybe 7 or 8, and next person, and next person. And if you complain of just knee pain your first visit, no other issues, they go, here's your medication. See me if it doesn't fix it. We want to make sure for you, again, getting back to it, you become your own best doctor, take care of your own body. And I put all these videos on my YouTube. Look at them again down the line, or if I ever pass away, you can see them there later on too as my archives. You know, they'll be there for hope forever unless YouTube dies. If that goes, then we have problems. You know, we have problems. YouTube goes, we have big issues. So we talked about earlier how these muscles, I'm going to sit on the table. I think I've done this before. If it breaks, it'll be funny later. Okay, call the doctor for me. So here, if I break down the knee, okay, we talked about earlier how we have your quad muscle in the middle. We have your lateralis muscle. If we break down the quad muscle, the big muscle, that big muscle is magnus in the middle, medialis inside, and also lateralis outside. Along the secondary muscle, the TFL on the outside, which can cause your foot to turn out, either cause other knee issues too. Knee ligaments in the joint itself for 1, 2, we have your anterior ligament that goes, basically you have an anterior ligament that becomes your quad muscle. It doesn't, does your quad muscle stop on top of the knee or does it go below the knee? Kind of a loaded question. Does your quad muscle stop here on the top or does it go beyond that? What do you think? Beyond. It's like the, what's the little toy things, like something in beyond? What's that little guy say? The space guy? The cartoon? The movie? What's it called? The one with the Toy Story, yeah. It goes something in beyond, right? It goes beyond, I'm just in my head. I see all my files in the top of the head. It goes from a muscle to a tendon that goes across the knee, on top of the knee, the patella, which is the medical term, and attaches below your patella, which is tibial tuberosity, your lower joint here, okay? So that area is actually your anterior ligament of your anterior ACL ligament here, anterior cruciate ligament on the very front. This is just terminology, how they look at things, orientation. So anterior is front, posterior back, medial inside, lateral outside. So you have ligaments, all those ligaments control stability of the knee. So if I take a step and my knee gets too much load, this way, with my foot coming out, then what can happen is now the inside ligament gets strained. Ligament strains for one are 3 phases. They grade them grade 1, grade 2, grade 3. Grade 1 you can basically heal on your own, rest, ice, maybe some therapy. Okay. Grade 2, maybe MRI time, a longer treatment plan, longer care, but again can sometimes heal on its own, sometimes not, based on other factors such as wearing the knee joint itself. Grade 3 is where it's a complete tear, that requires surgery. So if you're not getting better from a knee pain, especially the rotation of the knee and load, at that point it might be a grade 2 or 3, so you need the MRI first. The MRI shows a complete tear, you need surgery to fix it. They reattach the ligament for 1, 2, or pull ligament from other parts of your body and make that more supportive. All right. Other parts too, besides ligaments on the outside, is your meniscus. Meniscus, what it'll do, it'll cross inside of your joint to allow now rotation and also more load. That goes inside the joint all the way through. It's like a canal from here to here. One medial meniscus and lateral meniscus. All right. Any questions yet? So a lot of things control the knee. Beyond that, we talked about earlier too, your quad muscle becomes a tendon, attaches below the knee, and beyond, your outside TFL muscle that goes from your hip all the way down the side of your leg attaches below your knee on the side. And also in here, I want to call it, it's called vastus medialis obliquus, which is too long for me. So your inside thigh muscle attaches below the knee also. The problem with that is if my foot is out, here we talked about earlier, so my foot is coming out instead of being straight, what's going to happen to the knee? How do the muscles and ligaments adjust for that position? What do you think? What will happen is, I'll give you guys a clue. Do you guys, anyone know? I'll give you guys a clue. Is now the ligaments will make this your normal, but now the muscles on the outside will get tighter to support that different position, even that's your normal, and also the inside muscles get weaker. Has to be a balance. So your VMO muscle on the inside gets weaker, outside gets stronger, so where's going to be the pain? On the tighter side or the weaker side? What do you think? On top, but also perfect inside. Inside. So when I take a step, take a step, inside's going to be weak and go, oh, my knee pain's right there. All right, I'll give you a stretch for that one afterwards, or a strength exercise, get that stronger to give you my little easy one to do at home. All right? So we want to make sure, one thing, foot straight. Where's the knee pain? Front ACL ligament, LCL ligament outside, lateral MCL inside, or also back PCL ligament. But if I take a step if I take a step and I try to turn on my knee, here, medial meniscus. If I turn on the outside, lateral meniscus, and it hurts. So it's almost knowing where the pain is and which motion triggers it lets you know which one it is even before the MRI. How do people get the inside meniscus, you think, strained or torn? What do you think? What happens? What's common, especially in sports, like youth sports? What's a common sport, you think? Soccer. 1 out of 20 girls that play soccer, because their bones are still growing, limbs are still growing, the quad might be too strong based on their age, tear inside ligament. Okay. Outside is sometimes from skiing. Who skis here? Any water skiers or snow skiers?
Once in my life.
There you go. I did it a few times, but no more. I'm over 50. Chance of injury. I don't want to break anything. Over 50, I'm like, no more injuries. No chance of injuries. No, I don't call them high-risk sports, but something where there's a chance of injuries. Not only someone, myself, but someone coming down the hill and hitting me. It'd be bad. I don't like that. I have good health insurance, but I don't want to use it.
You know, Dr. May 2nd, I ended in urgent care.
Why?
Because my knee, the inflammation in my knee was so bad. You know, that they had to give me injection and it's like,
did it help?
Yes. Yeah.
Was it an infection or was it?
No, because now that you're talking about,
Yeah.
the position on the feet,
Yeah.
I was wearing the wrong shoes. Because I cannot wear soft shoes.
Mm-hmm. You almost need shoes that give you more support.
And I feel like my feet is going this way. And I end up with so much pain.
Mm-hmm. So make sure that your feet are straight when you're walking, not going the out anymore.
Now I know why I ended in urgent care.
You came for this one little thing. You can leave now if you want. You can leave. It's up to you.
Yeah. I give them away the shoes already.
It's almost like throw them away. Because next week you get more knee pain also, so you're just throwing them away.
No, because somebody else can use it.
That's true. I have a bike, just side story. I have a bike. My buddy's going to fix it now, but I was going to donate to the Disability American Veterans. They come to the house and pick stuff up. But the brakes didn't work. I'm like, do I donate it if the bad brakes? Some veteran's going to go down the street and kill himself. I feel so bad. That's just me. It's me. My own personal story. So now, we talked about which motion is painful, right? Is it lateral? Is it inside? Is it rotation for 1, 2? So what happens is, if my front ligament is strained, same thing. I'm going to take a step. I'm going to have a patient go, okay, put your left foot back and lean on that leg forward. Hurts right there. Good. So I know which ligament's strained and how to fix it. Same thing. If I did, for example, I was going to fall backwards and all of a sudden I caught myself hyperextended my knee, hyperextended it, locked it out, and now that's going to be your posterior delt muscle. Same thing inside. I was taking a step this way. Also my foot caught inside knee. Same thing outside knee too. So you only I was we call it the MOI, or mechanisms of injury, as what was the injury cause, which ligament or meniscus was torn or strained, or even muscle too. All right. You always look for bruising too, right, or swelling. One thing that can happen in your knee, if there's actually a meniscus inside the knee, is in front of your knee, if you feel it too, you have 2 little pockets below your kneecap. 2 little pockets right there. If meniscus is strained inside the knee, those pockets will fill with fluid. So you'll feel that fluid. I'm like, well, that feels like there's some water in there, people say, some pressure. So you'll feel that especially if it's a grade 2 or grade 3. You'll feel that. Okay, those little pockets right there. I should have wore shorts, but I want to show off my chicken legs. Okay, it's genetic, I say. So now, what is the home care to start? If you have a knee strain, knee sprain, RICE. What is RICE? What's RICE stand for? Do you guys know? Anyone in healthcare? What's that? Rest.
Compression. I don't know what the E is.
E is
Exercise.
exercise when you're ready. Or stretch. But rest, ice, compression, and exercise when you're ready. Where do you ice? Where would you ice the knee? What I do with my patients, just give them my little secret, I ice the front and back together, boom, 2 ice packs, and even take an ace bandage and wrap it around the knee so it compresses everything together. The knee is a closed joint. What does that mean when it's a closed joint? It doesn't drain very well. What does ice do? Pushes everything, the fluid out with a hypothermic type of condition, which is the ice. So you want to ice, I don't care if it's the front, back, side, I ice everything. Put a patient on the table, ice for 10 minutes, boom, get that swelling out. Helps a lot, especially grade 1 and grade 2. All right, any questions about that? Rest is going to be elevate your knee too. So what does elevate mean when you elevate your knee? Make sure your knee is above your heart. If I'm lying down, I want my knee, so all that fluid go back to my venous system and get out of my knee and out of my leg. When people have knee pain, what happens to their lower leg? Lower leg swells. Because they're walking too much on now that all that fluid goes to the foot, can't come back to the heart and get recycled through there. Right. Also compression, we talked about compression with the ice pack. Double up, compression with the ice at the same time. You may want to get a brace also for your knee. Just an elastic sleeve brace that goes on there. Very simple. So, and you can tell them like, hey, even though you're walking around, hey, I'm a triathlete, so I have to wear this on here all the time. My sponsor. That's what I do. All right? Makes my job easy. Makes you recover faster. Because sometimes we don't know, right? We're walking around, all of a sudden someone asks you, hey, Johnny, what's going on? You look over like, oh, there it goes again. You want to make sure you have some support when you're going in the world, this crazy world we live in. Now, these are my favorite ones. So your stretches, how do we stretch? If we talk about the muscles being the problem sometimes around the knee, how do you make the muscles looser first? Reset the knee forward, keep it even so these muscles aren't tight. We talked about earlier, you have your quad muscle here, right? How do you stretch your quad muscle? What do you normally do? What's your routine? What do you do? So lifting it is your exercise. How do you stretch the muscle? What I would do, if I'm sitting down, even just bring your foot more toward your other leg. That way would be good to do. Even if you're lying down too, get the knee to really, really come toward your body. So I'm here, just bring your ankle as far as you can go down your leg, bring it toward your body, and just stretch it out. If you have like one of the massage, you can do that too. Massage, go in that area, move that around. Same thing, if I'm here, I want to make the outside muscle here on the outside TFL bone stretched also. I'll come up at the same time. Now bring that knee across to my other shoulder to stretch out that TFL bone on the side too. So up and in to make the outside stretch. Same thing on this side. I'm going to come up and in to stretch the outside. And you can even, best way to do these stretches is lying in bed. Who lies in bed here? I do at least 6 hours a night. I try to get 6 hours. That's the best because you're lying down, you're flat. It's easier to bring your leg up to your body relative to sitting on the table. All right, easy stuff to do. Now, you also want to make sure your calf is stretched out. So a simple calf stretch here. I'll use this little table. Here. Boom, boom, boom. I'm going to do is put my foot, I'll show it on that side too, my foot here, say something that's stable, and then slowly lock my knee out and slowly get my body to shift forward. If I'm here and it feels a little tight, I get a little more, where it starts to get a little uncomfortable. That's where I want to go and hold that for about 30 seconds. Simple stuff. If you want to even take like a belt or a band and put it on your foot and just slowly let your foot or your toe come toward you, similar thing. I like this one here because it allows you really to you kind of judge how much load you can do and more and more and more. Use your body weight to lean forward to add more tension. And you might feel it more toward the middle of the calf muscle or toward the ankle or toward the knee, but whatever feels good. See, if I have a muscle that's tight anywhere in my calf, it's going to pull on my knee and my foot. So I want to help my whole body get better. So you want to make sure, same thing with the quads, you may feel it more toward the knee, toward the hip. Doesn't matter, keep stretching. Okay? Now you can do too, for the hip area here, The hip is, if you're comfortable, put a towel down the floor and slowly come down and then lean forward and come back up. Towel on the floor to support your knee, lean forward, come back up. Simple things you can do. When should you stretch? When? What time of day? What time of night? Weekends, holidays? I'm a morning person. Morning. Why morning? I was talking to a patient, I think, on yesterday about it. Why morning? Why is morning important?
And you'll be resting all night too.
Resting all night, your body's more relaxed, not tightened up yet. Plus, you're not checking your email or your phone. People aren't calling you. The dog's not at your table trying to, hey, or top of my bed. Let's go for a walk now. I'm like, okay. So always stretch first in the morning before you get busy. Before people say, I stretch at night. I'm like, do you really stretch at night? I'm like, sometimes I'm too tired. Yeah, of course you are. Stretch in the morning so it's out of the way. I tell some patients if they're having knee pain, is you're going to be active, starting to get active. We'll talk about it in a second too. Is you want to stretch first, go for your walk, do your stretches, do your exercise, and then come back and ice it. So rice is almost the rice portion with the compression and the icing is almost your whole process of getting 100%. You always want to ice the knee through your rehab no matter how much pain you're on or off so your knee gets 100%. That's the key. That's what I do with my patients at least. All right. Now, this is a good one. I need a volunteer for this one. Huh? Yep. Come on up. So you have two knees, you qualify. Grab a seat, grab a seat. This one I'm going to show you. I'll show you my chair. I want you to do, what we talked about earlier, right? How sometimes an inside knee is sometimes sore because the foot is coming out. Okay? So we do three things to kind of check that. What's your name?
Jose Luis.
Jose? Tony, nice to meet you. So here, bring your foot straight up. Boom. That's a normal knee extension exercise. That's normal. Okay? So this one will get the whole quad muscle stronger and more stretched out. Bring your foot all the way down. Now bring your foot out for me. Jose, right there. Now come straight up. Boom. Does that feel different?
Yes.
Where do you feel that now? Perfect. Positive test. So as your foot comes out, and comes out this way, now we're working the inside muscle, the VMO muscle now, which is your inside thigh muscle basically, inside quad, to make that muscle stronger to support the ligament, support the muscle, support the knee. Bring your foot down again. Now bring your foot in and now come straight up. Where do you feel that? Perfect. I'll pay you later, Jose, okay? Good job, good job. So outside knee now is where he feels more tension. Again, foot comes in, gets the outside ligaments of the knee, the quad muscle, and also TFL band to get stronger. We need strength to get our knees stronger, not just icing and stretching. Yes. But once you feel good enough, get working. Okay? Because we're sitting down too, Jose, there's no vertical load on your knee. So now you can do it easier versus if I was doing it standing, it's almost like, ow, ow. Sitting allows to take the load off so the knee can stay open and get that compression off of there. All right? How they feel?
Good.
Good. So I recommend someone do this stretch. Say up 1, outside, and then inside 10 times on one leg, then switch legs. That gets the knees stronger. Yep. So in, up, out, in, 10 times one leg, 10 times the other leg. Then go do jumping jacks afterwards too. If you want, if you want.
And then my cycle.
Stay strong, my friend. Thank you, Jose. Any questions about that? That's what we do. But it's one thing I tell my patients also, if you want the pain to go away completely, you have to get strong and stay strong. How often should we exercise? Should just on one day? Every day. Stretch every day, exercise every day. The days that end with, which days end with Y? Every day. Every day. Every day. I want to be mobile. I stretch today. I work out today so tomorrow feels good. I sleep tonight, hopefully, and I'll feel good, better tomorrow. What I do today affects tomorrow, the next week, so I want to make sure I stay active. That's my plan. All right? Next one. Good. Good. Wall sit exercise. So here, once you feel this, thank you, Jose, feels easy to you, okay, feels okay, and when I'm standing, that feels pretty good too, Okay, now I'm going to have a patient do. We'll come over here one more time, 2 more times actually. Here, I'm going to have him do now is have them go against the wall and then put their hands on their quad muscles, because you know what the quad muscles are now, right? I'm going to have them slowly bring their foot away from the wall, maybe about like whatever your foot width is, that same width from the wall. Then slowly slide your body down the wall to where you feel comfortable on those knees. Hold 10 seconds, then come back up. If the coming back up is hard, use your hands to push yourself back up. Some people might come all the way down, hold for a second, and then come all the way back up. You're like, oh, no way. You don't need to. There's no competition here, okay? So come down where you're comfortable, hold, keep your body. And why is keeping the body against the wall important? Support? And also good posture. Someone's doing this and going, yeah, doc, I think I'm doing right. I'm like, no, you're not. Good effort, though. Good try. But no. We want to have good posture all the time. Here, again, where should the feet be? Straight. Not like this. Want them straight the whole time. All right. I'm going to show. Come on. I need a demonstrator. What's your name?
Okay, Ramon.
Ramon? Tony, nice to meet you. Against the wall, my friend. Let's see if you can handle pretty far down. We'll see. Good against the wall. Good. Right there. And we do now. Hip against the wall. Head against the wall. And slowly come down. Is that okay?
Yeah.
Good. Can you go further? Good. Hold it right there.
Yeah, sure.
Then come back up. Look at that face. Good job. One more time. So whoa. Hold back. And then against the wall. Hips. Shoulder, head. But with your feet, bring this foot in. One more. There, and bring this foot too. There you go. So here, and then here. There you go. So your feet were off a little bit.
Okay.
Bring them more in. And now, one more. Right there. And now, come down, hold, and then come back up. All right? So make sure the feet, though, are even, not here. Because your right foot wants to come out a little bit.
Okay.
All right? Thank you, Ramon. All right? Yes. You can, yeah. If you're comfortable, if it doesn't going to slide on the wall, you put a ball back here so you can slide down the ball. Advantage of the wheel. Always here, always good posture first. Anything we do stuff. Because when we exercise, what happens is, if we exercise this way, our body's here. Your brain will react to repetition. We want to make sure our body stays here the whole time. Even doing this exercise, do the same thing. If I'm sitting down doing my knee exercises, make sure my back is straight the whole time, right? Last one. For now. So, if we're walking, we want to make sure we're going to walk in a good straight position, right? We want to make sure we're walking here, upright. What I tell my patients too is back on your heels. Put all your weight, instead of being forward, on your heels more, so we'll stay back here instead of being on our toes. Because my body, your structure, your spine is meant to hold 80% of your body, 80%, 80. You want to make sure that spine is getting loaded to take the pressure off the muscles in your hips, your knees, your calves, your quads, your everything. So we stay back here. Load your spine. People that have back problems or other issues too, they do this, take the pressure off the spine. Now you're causing more flexion of your body, causing more other problems. Even hair loss. I don't know. Maybe, I'm not sure. That's all I had in my head. Right? So now, what we want to do is just keep our body back. Again, we talked about Ramon too, keeping your feet even. We want to make sure we're walking heel to toe. When we do walk heel to toe, we want to make sure we load the heel first, a little bit outside foot, then come off the toe in the middle. So we want to make sure we're walking, make sure that toe, when we're walking, we take that step. Before that foot comes off the ground, we want to make sure that toe is loaded all the way. Why is it important to load the front of your toe? Where's your knee when you do that? Right over your toe. If I'm loading the outside foot, then where's my knee? Outside of my toe. Now we're doing this. Does that look good? No, it looks weird. If it looks weird, don't do it. So what I do now, same thing. If I'm here, my foot's outside. At that point, keep that abnormal position with the foot coming out. We're going to do now, we're going to load. I walk. Now my knee's inside my foot, causing more inside knee pain. So when we walk, our biomechanics tells me, especially when there's no trauma involved in knee pain, your mechanics are off a little bit. So you want to make sure we're walking that toe. When we come down, that knee goes right over that toe, and same thing with this one. So practicing it slowly forward and backwards, again, trains your brain to reset where your foot should be and the muscles in better alignment. So when you have knee pain, yes, rest, ice, compress, elevate. Knee pain starts going away, start your knee exercises. Sitting down. At that point, get your foot to come up, out, and in to get that full extension, range of motion, muscle looser for 1, 2. Once you're comfortable, start the wall sits. Once you're really comfortable, make sure you're walking in normal position, even beforehand too, with pushing off the toe. Because the problem is, once we've learned a bad habit, it becomes our habit. Unlearn it by making sure when we're taking a step, even practicing against the wall, foot comes down and push off that front toe. Just practice. It's like you can just do this all day long, about 4 or 5 times each side, switch feet, and feel. And I would do it initially, thinking about it. Do it first looking at your foot, making sure you're doing it properly. Once you're done looking at it, and then look up 4 or 5 times so now your brain feels it to relearn. So you feel the relearning process, not just looking at the whole time. Same thing. You're going to have a stronger and not as strong foot, so you're going to still be aware of that. But make sure when we're walking, if I have, like Ramon, I'm out coming down a little bit, make sure I'm thinking in my head, I can bring that toe in the whole time. So Ramon, make sure that we're walking, we get that foot in, and you're going to feel like you're cutting more pressure on the inside here because your foot's used to the outside. So feel inside pressure, look down a little bit, make sure that knee's coming over the toe, and you'll be good to go. Knee comes over the toe, then you're good to go. That's like a rhyme, right? Boom. All right. That's all I got for you. It's all in my head somewhere. That's the thing. Practice, practice, practice with your sister too having knee pain. Have her watch the video and or go through stretches too with her. But give her some time to heal. But really, when you see your sister walk, for example, today, or when you see her next, is make sure she's walking in a normal stride and the weight's coming over her toe, not here, and not even favoring one side where she's having problems on one side. The walking is so important to get that right. If not, the problem comes back more and more and more. It never really recovers. So the biomechanics of movement lets us know where things are working properly in better alignment or if they're off or not. All right? Any questions? I don't know any good jokes. I told all my jokes last time, I think. That's all I got. All right? So stretch, ice, exercise every day. Stay out of the heat if you can. Hydrate.
And tomorrow, the center is open,
Good. What are they doing tomorrow?
but I understand that they're not having lunch.
Oh, got it.
They're open.
Got it. So you can come here and hang out.
At 10 o'clock is IL, the operatic nurse.
Oh, good. Okay.
She's gonna be here. She's
Perfect.
great. She's gonna talk, it's free. She's gonna talk about digestion.
Ooh, smart. How many meals do you guys eat a day, out of curiosity?
How many what?
Meals do you eat a day? Do you 3 meals a day or 2 meals a day, 1 meal a day?
One, this lunch.
Perfect. I do 2. Which is all we really need. Just because, and then this probably should go over to tomorrow. I just read a book called Pulse Cure and one on something else also. A lot of it is our body needs time to digest to clear everything out. So giving it 12 hours of just, they call it fasting, but really just not eating.
I think you were thinking how many meals we're gonna eat in this.
Yeah.
center. I
This
said,
counts as one. So you want to make sure if 2 meals, say you eat breakfast and lunch, or even for example, if you eat lunch and dinner, it's almost give yourself enough time, at least 12 hours, so your whole system can clean itself out. So your intestinal microbes get moving, clear everything out for the next meal. You don't want to overwork them. Like traffic, right? What happens in traffic? If there's too much people on the road, everything stops. You want things to stop in your body. All right. Next month for me, it will be the third Wednesday of the month, will be neuropathy. So if you have, what is neuropathy, just as a preview, what are the 5 symptoms of neuropathy? What would you feel with neuropathy? What do you think?
Numbness?
Numbness, 1.
I didn't know there were 5.
I think there's 5, maybe 4, I don't know. Tingling. What else? What's number 3? Pain, good. Sharp pain, like something like, ow, hit you. That's 3. What else was the other? What's the 4th one, you think? Burning. Perfect. What's the last?
Maybe you can move you.
So lack of motion or weakness.
Yeah.
You guys are good. You guys know this stuff. I don't have to come next month. I'm good. All right, you guys are good. Thank you guys. Appreciate it.
Thank you.
Yeah, neuropathy is huge for people.